Welcome to the deep dive, everyone. Ready for a real medical puzzle. Today we're going to unpack a case of canine visceral leishmaniasis.
Or as it's often called, CanL.
Exactly. And it's a disease that maybe a lot of people haven't heard of, but it's a really big deal, especially in certain parts of the world.
Absolutely.
We'll be using a 2023 article from JAVMA. That's the Journal of the American Veterinary Medical Association.
Great journal.
It is. This article walks us through a pretty complex case of CanL. So picture this. You're a vet in Brazil, and this 5-year-old mixed breed dog comes in. The owners tell you, he's been acting weird for about 3 months.
Oh.
No energy, no appetite, just blah.
Yeah, pretty general. Could be a lot of things.
Right. And then just a few days before coming to the clinic, he starts having really severe trouble breathing.
Okay, now that's serious.
Yeah, it gets worse. So during the exam, the vets notice a few important things. He has some lesions around the eyes. He's got ticks all over him. His lymph nodes are swollen. And his spleen, it feels enlarged.
Starting to get a clearer picture now.
Yeah, but it's still a puzzle.
Yeah.
His blood work shows he's severely anemic. His platelet count is low lymphocytes, low albumin, high globulin, and his kidneys aren't looking good.
Oh, wow.
They do an ultrasound, and it confirms the spleen is massively enlarged and has this abnormal texture.
At that point, you got to be thinking something systemic, like a serious infection.
Unfortunately, the dog doesn't make it. He passes away from cardiorespiratory arrest. But the story's not over. The post-mortem exam shows that his lymph nodes throughout his body are enlarged, and get this, his spleen is described as having a meaty consistency.
Meaty. That's vivid.
Right. And it really suggests there's a lot of cellular infiltration and damage in the spleen. But then under the microscope, they find mastigotes in the spleen and lymph nodes.
Mastigotes. So leishmaniasis, PP, we found our culprit. That's what causes CanL.
Now, this all happened in Brazil, where, CanL is endemic. It's just part of the landscape there.
Right, but what's interesting is the article mentions that CanL cases have popped up in the U.S. and Canada too, even in dogs that haven't traveled.
Whoa, really?
Yeah.
That's a bit unnerving.
It is. It might be because of changes in the environment, making things better for the sandflies that carry the parasite. Their range is expanding.
So that's how they figured out what was going on with this dog.
Yeah.
But the big question is, what does this all mean? Not just for dogs in Brazil, but for dogs everywhere.
That's the burning question, and that's exactly what we'll dive into next as we keep exploring this case of canine visceral leishmaniasis.
Okay, so we know this dog in Brazil had CanL, but people listening are probably like, okay, that's Brazil, but what about, where I live? Should I be worried about this?
Right. It's a good question, and it's really important to remember that these infectious diseases, they don't always stay put. They can spread.
Especially with climate change and stuff, that can change where those sandflies can live.
Exactly. And the article even says that sandflies are spreading out. So that means there's a chance CanL could show up in new places.
Okay, that is a little scary. But let's back up a sec. What makes CanL so hard to diagnose in the first place?
Well, it often looks like other diseases. Like those early symptoms, the tiredness, not eating, weakness, those can be really misleading.
Yeah, you think, oh, my dog's just a little under the weather.
Yeah.
But it could be something way worse.
Right. And then on top of that, when the parasite gets in, it messes with the dog's immune system. That can cause damage to different organs.
Like a chain reaction.
Yeah, kind of. The spleen, liver, and kidneys, those are usually hit the hardest.
In this case, the vets had to, piece together all these clues. They looked at the dog's symptoms, ran blood tests, did imaging, and even look at tissues under a microscope.
It really shows how important it is to be thorough, You can't just jump to conclusions. You got to look at the whole picture.
And speaking of the whole picture, the article goes into a lot of detail about the dog's blood work and what they found during the post-mortem exam.
Oh, yeah.
Yeah, and it gives us a lot of information about how CanL affects the body. Remember how the blood work showed severe anemia? Well, that's why the dog was so weak and tired. He didn't have enough red blood cells. Plus, the low platelets could have caused bleeding problems, which would have made everything worse.
Makes sense.
And then his serum biochemistry was off too. Low albumin, high globulin.
That's a classic sign of CanL. That high globulin means the body's trying to fight the infection by making antibodies.
Right. And his kidneys weren't functioning right either.
Yeah, that's another common problem with CanL. The parasite can damage the kidneys and then waste products build up in the blood. It's not good.
So putting it all together, it's pretty clear that CanL can wreak havoc on a dog's body.
Absolutely. It's a serious disease, and it shows us why catching it early and starting treatment is so important.
But here's the thing. Even with treatment, Getting rid of the parasite completely is really tough.
That's the crux of the matter. Treatment can make the dog feel better and maybe live longer, but it doesn't cure them.
So that means prevention is even more important.
Right. Definitely. Avoiding sandfly bites is key. That might mean using insecticides, keeping dogs inside when sandflies are most active, and staying away from places where they hang out.
And there's vaccination too, right? At least in some parts of the world.
Yep. In some places, vaccination can really lower the chances of a dog getting sick, although it might not stop them from getting infected entirely.
So it's like we're in this race against time. We got to be aware of CanL, figure out ways to stop it from spreading, and keep an eye out for any signs of it in our dogs.
I think that's a good way to put it. This case really shows how important it is to be proactive when it comes to these new diseases and keeping our pets safe.
And it's not just about dogs. This affects everyone, Animal health, human health, they're all connected.
Exactly. We've got to work together to stay ahead of these challenges and keep everyone, humans and animals, healthy.
All right, so we've talked about diagnosing CanL and how tricky it can be. But let's say you're a vet and you've got this dog. You think it might be CanL. What's next?
Well, first things first, you got to be sure, right? Confirm that diagnosis.
So more tests.
Probably. You're going to want to look at the blood work again, maybe do some imaging, maybe even take a biopsy to really look at the tissues under the microscope.
And once you're sure it's CanL, then what? What do you tell the owner?
Well, that's when you have to talk about treatment options.
And is there like a standard treatment for CanL?
Not really. It's not one size fits all, unfortunately.
So what are the options? I know the article talked about a drug called allopurinol.
Yeah, that's usually the first thing vets try. It's an antiparasitic that can help keep the parasite under control. Usually it's given as a pill, and the dog might have to take it for a long time, maybe even their whole life.
But it doesn't kill all the parasites, right?
That's the problem. It doesn't get rid of them completely, so the dog could get sick again, especially if they stop taking the medication.
So it's kind of a long-term commitment for everybody involved.
It is. That's why it's so important for the vet and the owner to be on the same page, The owner needs to understand that this is going to take some work.
I get it. Now, there were some other drugs mentioned in the article, like pentavalent antimonials and amphotericin B. Do vets ever use those?
Sometimes, yeah. If the case is really bad or if the allopurinol isn't working, those might be options. But they can have some nasty side effects, so you have to be careful.
Okay, that makes sense. So what about the dog's chances, their prognosis? What can owners expect if their dog has CanL?
That's the million-dollar question. And it's tough to say for sure. It really depends. How bad of the disease? Did they catch it early? Is the dog healthy otherwise? How well are they responding to treatment? There are a lot of factors.
So it's really different for every dog.
Pretty much, yeah. Some dogs, they go into remission and do okay as long as they keep getting treatment. Others, they have more serious complications and they might not live as long.
It just makes you realize how important it is to prevent CanL in the first place, right? Like avoiding those sandfly bites and getting the vaccine if you can.
You got it. Prevention is key, especially with a disease like this.
Well, I think we've learned a lot today about canine visceral leishmaniasis. We talked about how it's diagnosed, the challenges of treatment, and why prevention is so important.
Yeah, it's a fascinating case, and it really shows how connected everything is, Animal health, human health, the environment, it's all related.
It also shows how much we still have to learn about these emerging diseases and how important it is to be proactive and protect ourselves and our pets.
Absolutely. The more we know, the better prepared we are.
So to our listeners out there, be aware of CanL, talk to your vet about how to prevent it, and if you see anything unusual with your dog, don't wait. Get him to the vet right away.
Early detection is so important. Let's keep those tails wagging.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.